NAC for autism. What every parent needs to know. Are you a parent on the lookout for safe and effective ways to support your child with autism? If you're facing challenges like intense irritability, repetitive behaviors, or social interaction difficulties, you know how overwhelming this journey can be. It often feels like you're sifting through a mountain of conflicting information, and navigating it can feel like a full-time job. In this video, we're here to cut through that noise. We'll provide you with a comprehensive science-backed guide to N-Acetylcysteine, or NAC for short. We'll explain what NAC is, how it works in the brain, what the research really says about its effects on autism symptoms, and the essential information you need to consider before diving in. My aim is to equip you with clear, evidence-based insights so you can make informed decisions for your child, in collaboration with your doctor. What is NAC? The science, simplified. Let's start with the basics. What exactly is N-Acetylcysteine, or NAC? At its core, NAC is a supplement derived from a natural amino acid called cysteine. It's been used in mainstream medicine for decades, primarily in hospitals to treat acetaminophen overdose and to help break up thick mucus in lung conditions. But its potential role in brain health is what's drawing attention in discussions about autism. To grasp how NAC works, you need to know about glutathione. Think of glutathione as your body's master antioxidant. Its job is to protect your cells from damage caused by oxidative stress. You can think of oxidative stress like rust in your body. It's a natural byproduct of energy production, but too much of it can lead to damage and inflammation. Some research suggests that children with autism may have lower levels of glutathione and higher levels of oxidative stress. That's where NAC comes into play. NAC is a direct precursor to glutathione. By supplementing with NAC, you're essentially giving your body the building blocks it needs to produce more of this vital antioxidant, helping to combat oxidative stress and reduce inflammation in the brain. How might NAC help in autism? The brain connection. Beyond its antioxidant role, NAC has another fascinating function that's particularly relevant to autism. It helps to balance a powerful brain chemical called glutamate. Glutamate is the brain's primary excitatory neurotransmitter, essential for learning and memory. You can think of it as the gas pedal of the brain. It gets things moving. However, too much glutamate can lead to overexcitement in the brain, which may contribute to some core features of autism like irritability, hyperactivity, and repetitive behaviors. NAC has been shown to help regulate glutamate levels, effectively easing off that gas pedal and restoring a better balance between the brain's excitatory and inhibitory systems. So when we discuss NAC for autism, we're really looking at a two-pronged approach, reducing oxidative stress and inflammation, and balancing key neurotransmitter systems. This unique combination makes it an intriguing area of research. The evidence. What do the studies actually say? Now let's get to the most crucial part of the conversation. It's one thing to understand the theory, but what does the clinical research actually show? The evidence for NAC in autism is promising, but still evolving. The most consistent finding across multiple studies is NAC's ability to reduce irritability. We're talking about the kind of irritability that can be incredibly challenging for families: aggression, severe tantrums, and self-injurious behaviors. A pilot study from Stanford University, for instance, used a well-known clinical scale called the Aberrant Behavior Checklist, or ABC. They found that NAC treatment significantly decreased irritability scores. Other studies, including those where NAC was used alongside medications like risperidone, also showed a notable reduction in irritability compared to a placebo. While it may not be as powerful as some antipsychotic medications, NAC offers a valuable alternative with fewer side effects. NAC also shows promise in reducing repetitive and stereotypic behaviors. One study noted that children taking NAC experienced a measurable decrease in these behaviors. A case report on an 8-year-old boy found that after starting on 800 milliliters of NAC per day, his fixation on a single toy car diminished. He became interested in other toys, and his insistence on frequent haircuts significantly decreased. When it comes to social skills, the evidence is a bit mixed. Some meta-analyses and retrospective reviews have found that NAC supplementation can lead to improvements in social awareness after about 8 to 12 weeks. One review of young children noted reduced social withdrawal and better interpersonal relationships. However, other larger, placebo-controlled trials have found no significant improvement in core social deficits, even when they measured increased glutathione levels in the blood. This suggests that while NAC is having a biological effect, it may not always translate into the clinical improvements in social interaction that we hope for. Similarly, some studies show a significant reduction in hyperactivity, while others do not. It's essential to understand these nuances. Much of the research is based on smaller pilot studies, case reports, or trials where NAC is used as an add-on therapy. We still need larger, more definitive studies to confirm these findings and identify who is most likely to benefit. If you're finding this exploration of the science and research helpful, consider subscribing to the channel. I'm committed to providing you with clear, evidence-based content to support you on your parenting journey. The critical warning: when to be cautious. Before we go any further, there's an important piece of information that often gets overlooked. It's a crucial consideration for clinicians who frequently use NAC, and it's vital for building trust, because it shows a deep understanding of the complexities involved in autism interventions. You need to be very cautious about starting NAC if your child has a known or suspected issue with yeast or candida overgrowth. NAC can break down biofilms, which are protective shields that bacteria and yeast create. While this can be beneficial in some contexts, if there's significant yeast overgrowth, breaking down its biofilm can release a flood of toxins and actually worsen symptoms, as the yeast can use components of NAC as a food source. This is why it is essential to work with a knowledgeable practitioner who can assess and address any underlying gut issues before considering NAC. Dosage and practical application: getting it right. If you and your doctor decide that a trial of NAC is appropriate, the approach is always to start low and go slow. This helps minimize potential side effects and allows you to see how your child responds. For children, studies often start with a dose of around 400 to 600 milligrams per day, typically split into 2 doses. From there, depending on your child's age, weight, and response, the dose may be gradually increased over several weeks. Many clinical trials have used doses ranging from 1,200 milliliters to as high as 2,700 milliliters per day, again divided into 2 or 3 daily doses to maintain stable levels and improve tolerability. A typical trial period to assess effectiveness is usually between 8 and 12 weeks. If you don't see any noticeable changes in that time frame, it may be that NAC isn't the right fit for your child. Remember, this isn't medical advice, but rather a summary of what has been used in research settings. The right dosage and plan for your child should always be determined by your healthcare provider. Safety and side effects: what to expect. The good news is that across all the research, NAC has been shown to be generally safe and well tolerated by children with autism. It's an FDA-approved medication for other conditions, so it has a solid history of safety data behind it. When side effects do occur, they're usually mild and gastrointestinal. This can include things like nausea, an upset stomach, diarrhea, or a sulfur-like taste or smell. These issues can often be resolved by adjusting the dose. Less common side effects might include constipation or a reduced appetite. It is worth noting that NAC tends to have far fewer side effects than the antipsychotic medications often used to treat irritability, with none of the associated risks of weight gain or metabolic issues. How to talk to your doctor. When discussing NAC with your doctor, aim for a collaborative conversation. You know your child best, and they're the medical expert. The goal is to work together. Come prepared to your appointment. Share your child's specific symptoms that you think NAC might help with, like irritability or repetitive behaviors. You can even mention the studies that looked at reductions in the aberrant behavior checklist irritability score. Ask for a baseline assessment of these behaviors, so you have an objective way to measure any changes. Discuss a clear plan for a trial period, including a starting dose, a slow titration schedule, and how long you'll try it. Typically that 8 to 12 week window. Talk about how it will fit in with any existing therapies or medications your child is already on. By framing the conversation around evidence, safety, and a structured plan, you demonstrate that you're an informed and proactive partner in your child's care. So what's the bottom line? N-Acetylcysteine, or NS, is a promising supplement that targets some of the underlying biological processes that may contribute to autism symptoms, particularly oxidative stress and glutamate imbalance. The research suggests it can be an effective tool for reducing irritability and may also help with hyperactivity and repetitive behaviors in some children. However, the evidence isn't definitive, especially for core social symptoms, and it's not a cure. It's a potential piece of a much larger puzzle, and it comes with important considerations, like the warning about yeast overgrowth. Ultimately, the decision to try NAC is a personal one that should be made in close consultation with a qualified healthcare professional who understands your child's unique health profile. This information is here to empower you, giving you the language and data to have that conversation and move forward with knowledge. Your first and most important step should always be a conversation with your child's doctor. Never start any new supplement without their guidance. Thank you for taking the time to educate yourself. I wish you the very best on your journey.